Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk specifically about CLIA Certificate of Waiver. I did a video quite a while ago on CLIA Certificate of Waiver, and there is a bunch of information out there about CLIA. It can be really confusing, but most of my viewers and most people in the medical field are going to be needing a CLIA Certificate of Waiver over a CLIA certificate. And I will explain the differences between the two in this video. I will also explain what is the best way to manage your CLIA certificate laboratory, and also where I'm going to put the links for more resources for you so that you can go on and do your own due diligence. All right, so CLIA Certificate of Waiver versus a CLIA certificate. There are different complexities of tests, and based on the tests that are going to be ran in your office depends on which level of CLIA you actually need. Now, a CLIA Certificate of Waiver is actually the lowest complexity, and they're basically tests that someone, the powers that be, like I talk about in other videos, because I'm not exactly sure who it is. I think it's a collaboration between the CDC and the CMS and other entities that determine these point of care tests are not going to be harmful to patients if there's an erroneous result. So it's more of the very fast point of care testing that gives information on how to treat a patient, but it's not going to be detrimental to their health if there was some erroneous, like it says, results of the test. Examples of tests that are waived would be dipsticks for urinalysis. It could be a finger poke for glucose, rapid streps, rapid flu, rapid COVID tests, those HCG, urine HCG tests, those tests that are done usually in primary care, family medicine, and urgent cares, okay? These are going to be things that give results pretty quick and just gives an idea to confirm kind of some of the differential diagnosis that a provider might have for treating a patient who isn't feeling well. There are also some tests out there that are still CLIA waived, but they use some kind of machine that can be kept in-house, and it analyzes the results. And that can be something that you would have to look up on the CDC website. So there is a CDC website that keeps an updated list of all of the laboratory tests that can be done in-house that are considered CLIA waived. And if you are performing these tests in your practice, then you only need to provide a CLIA Certificate of Waiver showing that you have a CLIA certification, but it's to perform the waived tests. And not only when you are performing these tests, you need to have that certificate from CLIA to show that you've put in for it and that you're acknowledging you're only doing these very simple, straightforward tests, but you also have to indicate that on your billing of claims as well for these services. So all CLIA waived tests are indicated with a QW modifier on your claims showing that you have a CLIA waiver of certificate and that you're following all of the requirements for performing CLIA waived tests. And that is something that a lot of people aren't aware of, the billing component of this. So if you are going to be doing these very simple point of care tests, their CPT codes and the explanation of the tests are on the link for the CDC of CLIA waived tests categorization, then you can do that. Now, The caveat to all of this and the specifications is you have to make sure that you're following specific manufacturer guidelines when you're performing these tests. That is what is expected of you when you have a CLIA Certificate of Waiver. And when you're filling out the application, it asks for a lab director, and usually it's the provider owner of the practice. And it is ultimately their responsibility to make sure all staff are trained on how to perform the tests per the manufacturer's package insert, and that everything is being followed, QCs are being followed as needed, and everything is being documented as well. If you're going to be performing tests that are not on that list of CLIA waived tests, then that means that you actually need a CLIA waiver. And there is so much that goes into that, because there's like PPM tests, moderate complexity, high complexity tests, and depending on which level you're at has more requirements. Lab directors actually have to be someone who has experience in education in directing labs. Your staff has to have background and education in working with labs. I mean, it gets a lot bigger. So that's why a lot of, especially internal med, family practices, urgent cares just do the CLIA Certificate of Waiver to do what they can in-house, and then they collect specimens and send it to an outside laboratory to perform all of the other things that would be needed, like swabs for more confirmation of different testing, blood work, more urine analysis at a deeper level, microalbumins, tissue samples from biopsies. Along those lines are the things that would be in that CLIA certificate. And like I said, it's just a lot more complex. The running of your lab internally is going to need to be small, but it needs to be running as a well-oiled machine. It needs to have somebody who oversees it on your staff. Personally, I think a provider should choose like the head MA or the head nurse to be overseeing this. They should be sitting down with the provider. You guys should be going over that package insert for every test to make sure everything is ran the same way. Trainings are conducted regularly, especially when you receive new tests. You ask the manufacturer any questions that you might have. You look to see how often you need to do quality control checks. Is it every time you open a new packet, you have to run a control and document it and keep it stored somewhere? I always had a binder with all of the different point of care tests that we ran, and every time somebody had to open a new package, because that's usually what it is, if you're not using a machine, you have to do a quality control or test at the beginning to make sure that it's running as expected. So there's usually a test kit in there for you to run a control to get a positive and a negative to make sure it's coming out as expected. And if it does, you document it. You make sure that you can show in the future if anything comes up that questions that. So you keep your documentation all in one place. And then we would write on the box when it was QC'd, so everybody else knew that it was QC'd and it was okay to use. I recommend that. I taught all of my staff how to do the QCs, because if I was not around or not available, I didn't want it to hold up services to patients. And so I did in-services to get them all trained, documented their trainings in that same book where I kept the QCs, and then they were able to do it, and they would write when it was QC'd on the box. So it was kind of peace of mind. It was really nice. I just kept up to make sure everybody was current on their trainings. And I suggest doing that for yourself as well, unless you have, more staff than you can, or you run your practice a different way, but we were pretty small, so it was easier to do it that way. Every location that you have that does CLIA waived tests needs a certificate of CLIA waiver. So you need to make sure, if you have 2 locations and you're doing the same tests in both locations, that you need to make sure you have a certificate for each location. Also, you're not required to have an inspection by CLIA because they are waived tests, but that doesn't mean that you couldn't get a surprise inspection because there was a complaint or there's a concern somehow and they caught wind and they come in. So that's why it's really important that your lab is in a designated area as required. There is the documentation for QCing, for training your staff, for sitting down with the medical lab director, owner of the practice most likely, to go over those package inserts for everything you're running, that you show that it was looked at and you're doing your due diligence internally to make sure everything is followed as expected when running those tests, so there is no question with the results. You need to pay attention to expiration dates. That's really important. And every year there's reevaluations of testing, and they always are adding more, it seems like, to the CLIA waived test list. So if there's a test that right now is not a waived test, but you would really like to be able to offer it in your practice at some point in the future, just keep checking it, because there is a chance that if it's a pretty simple, straightforward test, that once, the kinks kind of get worked out and stuff, and they see that, it's pretty innocuous, that they will add it to the list. It doesn't mean that, it will never be on that list. It could at some point, so just make sure you keep checking it. And if you have any questions about billing, just know that if your tests that you're running and the CPT codes with the explanations are on that CLIA waived test list, then you can use that QW modifier. And I would just add the QW modifier to your master list of CPT codes, so it's always there and you don't have to try to remember to add the modifier every time it's used. To apply for a CLIA waiver, you can either go to the CMS website, and the link is pretty easy to find, or you can go to your state's specific health authority and they will have a link for the application as well. You need to make sure that you have a list of the tests that you're going to be performing in-house with the CPT codes, so that they can see that you understand what's a waived test and that they can approve it. Once they approve it, you'll get like a ticket that says you need to pay for your CLIA waived certificate, and that means pretty much that you've been approved. You need to pay the fee, and it's good for 2 years. CLIA waived certificates have to be renewed every 2 years. You usually receive a reminder in the mail with whatever email and address you use on those CLIA certificates. So it will come in the mail reminding you, hey, it's coming up that it needs to be renewed. It's really simple. You pay the money, they send you a new certificate. The certificate has to be mounted in the lab. It has to be visible. So usually I just got a cheap picture frame from the Dollar Tree, which is now the $1.25 tree. But I would put the certificate in the frame and we would just hang it in the lab area. Everybody knew to come to me if they had questions, or the doctor, of course, and we just had a very open communication. The book with the quality control and the trainings and everything was in a binder, and I used dividers, labeling it by each test, so it was easy to find the documents, and it was stored in the lab area, so it was easy to obtain if anybody needed it. I also kept the package inserts readily available, so if anybody had any questions, somebody was new, whatever could come up, it would be an easy reference as well. You can find those online, I'm sure, too, but I like paper. I'm old school, so I would just put it with all the other paper so it was easy to find. The resources that I talked about, the links at the beginning of this video, I'm actually going to put it in the description of this video, and then I will also try to get it uploaded to the resources page on my website so that you could also go there in the future if you forget which video this was on, but you knew that I have a resources page on my website, www.integralclinicsolutions.com. You would be able to go there. I'll put the CMS link to CLIA waived tests. I'll try to put the actual link to the application, but you can also just Google your state and say, Oregon CLIA waiver certification application, and you should be able to find it that way as well. If you have any questions or comments, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this information with your colleagues who might be confused about CLIA or have questions about CLIA. Take care of yourself, and we'll see you next time. Bye-bye.